us, my beloved friend,
Dókítà olùfẹ́ Amos àti wà pẹ̀lú ara wa ní ọ̀pọ̀lọpọ̀ ọdún.
things that will be useful for our life.
Yóò bá wa sọ̀rọ̀ nípa ohun tí ó ṣe wá láǹfààní nípa ìlera ayé wa.
I'm glad that he's coming to talk now because
Yóò wá sọ̀rọ̀ báyìí.
I'm saying to you,
Yóò sọ fún ọ.
when you see the kingdom of God,
Nígbà tó bá gba ìjọba Ọlọ́run,
other things will follow.
àwọn nǹkan mìíràn yóò tẹ̀lé.
He's going to give you some of the nuggets
Ara ohun tí ó tẹ̀lé ni àwọn kókó ọ̀rọ̀ tí ó tẹ̀lé yóò bá wa
that
sọ.
will be beneficial to your life.
Tí ó sì ṣe wá láǹfààní nínú ara wa.
So please be patient
Ẹ jẹ́ ká farabalẹ̀.
and may God bless you.
Ọlọ́run yóò gbógun wa.
Thank you, Pastor. That was a very wonderful message. I indeed enjoyed it. And I'll say good afternoon, everybody here. The mamas, the papas, the brothers and sisters here. I bring you greetings from the medical field. We have listened to the spiritual part of the word. This program is a very robust program that has a fusion of medical and spiritual. Nothing can be more important than this. I'll be talking to us on something that is very, very important because having good health is part of living good life on earth. So my topic today is on hypertension, the silent killer. So I'm not discussing anything to scare you or to inform us about okay, I will try not to use medical jargons, but there's no way I will not delay into the jargon, but someone will be interpreting. Yeah? Yes, alright, thank you, we'll work together. I'm going to define hypertension. Hypertension simply means a high blood pressure above normal. So, which means, we must know what hypertension is. What are the symptoms of hypertension? What causes hypertension? What are the complications of hypertension? And how to treat hypertension? I think hypertension is called, or blood pressure is called ìfúnpá. Yes. Blood pressure is ìfúnpá. Ìfúnpá, right? Alright. Hypertension, like I said, is high blood pressure above a normal value. Not ẹ̀jẹ̀ really. Pressure, blood pressure. Yes, yes. Because there is blood and there is blood vessel. Yeah. So when it's very high, above a normal value, is what we call hypertension. So which means there's a normal value for everybody when you check your blood pressure. So ideally, everybody's blood pressure should be below 140/90.
140/90.
140/90.
140/90.
Remember, it's not a doctor, right? So you are being well, sir. So if I correct you, please don't be offended, right? So that we'll get the message correctly. When the only way we can diagnose hypertension is when we wrap patient monitor on your hand, what we call BP monitor. And there are different types. There are those that you check in the hospital, and there are those that you can buy and check in your house. So in talking of What are the symptoms when you have hypertension?
Kí ni àwọn tá a máa rí nígbà tá a bá ní ìfúnpá tó ga?
There are two groups of people.
Oríṣiríṣi méjì ni ó wà.
Those that have symptoms.
Àwọn tó ní ohun tí a fi dámọ̀.
And those that don't have symptoms.
Àwọn tó sì ní ohun tí a fi dámọ̀ pẹ̀lú.
Those that have symptoms, I will call them the lucky ones.
Àwọn tó ní ohun tí a fi dámọ̀ bí wọ́n ní àwọn ẹran ṣoríire.
And those that don't have symptoms are the unlucky ones.
Àwọn tí wọ́n ò sí ní ohun tí a fi dámọ̀ wà lè ní kí wọ́n ò ṣoríire.
So for those that don't have symptoms,
àwọn tí wọ́n ò ní ohun tí a fi dámọ̀.
They can be as healthy as I'm looking or as he is looking.
Wọ́n lè máa wò dáadáa bá a ṣe ń wò yìí.
But if you check their blood pressure,
nígbà tá a bá wo ìfúnpá wọn.
they might be hitting the roof.
Wọ́n ti máa ga gidigidi gan.
Now those people, there's nothing wrong with them.
Àwọn èèyàn kò ṣe wọ́n.
It's fine, and like every other person.
Wọ́n dùn wò bá ṣe wà yìí.
Then there's another group of people.
Àwọn ẹgbẹ́ bí wọ́n sì wà pẹ̀lú.
That are the lucky ones.
Tí wọ́n ṣe oríire lọ́pọ̀lọpọ̀.
They are lucky because their blood, they have symptoms.
Wọ́n ṣe oríire pé wọ́n ní àwọn tí a fi dàpọ̀ fún wọn ní ìfúnpá tó ga.
They could have headache.
Orí lè máa fọ́ wọn.
They might not see very well.
Wọ́n lè má yọ̀ dáadáa.
They might feel very tired.
Wọ́n lè máa rẹ̀ wọ́n.
So that would be a reason for them to go to the hospital.
Ó lè jẹ́ ìdí fún wọn láti lọ sí ilé ìwòsàn.
So when they go to the hospital, generally they will need to check your blood pressure.
Tó bá délé ìwòsàn, wọ́n á ní àǹfààní láti yẹ ìfúnpá wọn wò.
So when you see the blood pressure,
Tàbá ìfúnpá yìí.
that's only when you now know that this blood pressure is very, very high.
Nígbà yẹn sọ pé ìfúnpá yìí ga lọ́pọ̀lọpọ̀.
So that kind of person or that category of patient,
ìwé ẹni bẹ́ẹ̀ yìí.
we will now start treating that person.
A ó máa wá ṣe ìtọ́jú rẹ̀.
But those ones that don't have any symptom,
àwọn tí wọn ò ní ohun ìdánimọ̀.
they can just be talking and collapse.
wọ́n lè máa sọ̀rọ̀ kí wọ́n ṣubú
Because you don't even know that their blood pressure is very
yóò bí
high.
ìfúnpá wọn ti ga.
Alright, so what causes hypertension?
Kí ló ń fa ìfúnpá gíga?
I have a bad news
oníròyìn tó
and a good news.
àti tó dáa.
95% of times,
ní ọ̀pọ̀lọpọ̀ ìwọ̀n tó pọ̀ gidigidi lọ fáwọn ènìyàn.
we don't have anything that is causing hypertension.
a ní ohun tó ń fa ìfúnpá gíga.
But 5% of times,
ṣùgbọ́n ìdá márùn-ún ní ìgbà mìíràn.
hypertension can be caused by
ìfúnpá gíga lè wá nípasẹ̀
high cholesterol.
nígbà tí ọ̀nà bá pọ̀ jù ní ẹ̀jẹ̀.
If you have kidney problems,
tí o bá ní kídìnì tí ó dáa.
you know. But generally speaking, hypertension is said to be in the family.
ìfúnpá gíga ó lè wà nínú ìdílé.
That is, it runs in the family.
ó lè máa jẹ nínú ìwọ̀n ìdílé.
If your father has high blood
tí
pressure,
wọ́n fẹ́ bá ní ìfúnpá tó ga.
you could have high blood
ó
pressure.
ṣeé ṣe kí wọ́n náà lè ní.
If your mother has high blood pressure,
tí ààrẹ bá ní pẹ̀lú.
you too will have a high
ó
blood
ṣeé
pressure.
ṣe kí wọ́n náà ní.
You know, so those are how we classify hypertension. Let's say how we classify high blood pressure and what causes them.
èyí tí wọ́n sì ké bẹ́ẹ̀ ṣe lè ṣe àpèjúwe ìfúnpá gíga àtàwọn tí ó ní.
What are the complications of this hypertension?
kí ni àbáyọrí àwọn ìfúnpá gíga yìí?
That is, if you have high blood pressure and you don't treat it,
tó o bá ní ìfúnpá tó ga tó o sì ṣe àbójútó rẹ̀.
what can happen?
kí ni ó lè ṣẹlẹ̀?
I'll give an illustration using a balloon.
màá ṣe àpèjúwe nípa tí wọ́n lo fèrè.
Blow, blow, no blow, blow.
ẹ bá fèrè tá a bá fún.
When you are blowing balloon,
tá a bá fún fèrè. tá a fún.
you know, that is what happens in your blood vessel.
ohun tí ṣẹlẹ̀ sí ìfúnpá gíga wa
So
nìyẹn.
there's a level that the balloon will have, you will blow it. What will happen?
ó ní ìpele ta lè fún dé.
It will blast, it will burst.
tá a bá fún kọjá bẹ́ẹ̀.
That is what happens when you have a blood pressure that is very, very high.
ohun tó máa ń ṣẹlẹ̀ ní ìní tí a bá ní ìfúnpá tó ga gidigidi gan.
So because the blood vessels in the brain,
torí àwọn tó ń gbé èdè nínú ọpọlọ.
they are very tiny.
wọ́n kéré dandan gidi gan.
If the blood vessel blasts,
tí ìkún tó gbìlẹ̀ bá bẹ́.
that person will have stroke.
ènìyàn á ọ lápá.
So which means one of the causes of hypertension, one of the complications of hypertension
ohun kan náà tó ń jẹ́ àbáyọrí ẹ̀.
is stroke.
òun ni kí wọ́n ní apá ríro àbúṣe ríro.
So I'm starting from my head.
Mo bẹ̀rẹ̀ láti orí mi báyìí.
So it has caused stroke in the head.
Ó lè fa kí orí náà kó ya ọdún pàṣẹ tí orí.
And when somebody has stroke that occurs in the head,
Tí orí bá tí èèyàn bá ti ya ọdún pàṣẹ orí.
the person will not be able to move a part of the body that is controlled.
Ẹnìyàn lè gbé àyà ara tí ó ṣàkóso rẹ̀.
Another part is we go down.
Ẹ̀gbọ́n náà ló máa wá sálẹ̀.
We are now at the level of the heart.
Ó wá síbi ọkàn.
Hypertension
Ìfàmìgà.
can cause heart failure.
Ó lè jẹ́ kí ọkàn dáwọ́ dúró.
Hypertension will make you to have heart failure.
Ìfàmìgà lè jẹ́ kí ọkàn rẹ̀ kó dáwọ́ dúró.
Now we go down.
Àwa sálẹ̀.
We are getting to the kidney.
Ó bọ́ sínú kíndìnrín báyìí kíndìnrín.
Hypertension
Ìfàmìgà.
can cause kidney failure.
Ó lè kí kíndìnrín ẹ̀kọ́ dáwọ́ dúró kó má ṣiṣẹ́ mọ́.
You see, hypertension and its complications are what we have just described.
Àti àwọn tó ń báyọ̀ tí mo sọ yìí.
So I'm sure nobody will want to have a stroke.
Mọ̀ pé òṣèlú náà ní kíndìnrín tó fẹ́ ní ṣọ́ọ̀kì.
Nobody will want to have a heart problem.
Ẹgbẹ́ ní ọkàn tó ní ìdàkúnlẹ̀.
And nobody will want to have a kidney problem.
Àwọn ìfẹ́ ní kíndìnrín lọ tó wá ní ìdàkúnlẹ̀.
So the next thing is, how do we treat hypertension?
Ohun tó kàn ní báwo ni a ṣe máa ṣètọ́jú ìfọ̀nìgbà?
How do we treat high blood pressure?
Báwo la ṣe máa ṣètọ́jú ẹ̀mí rúru?
Now, treatment of high blood pressure will be in two categories.
Ọ̀nà méjì la ṣe ti ṣètọ́jú ẹ̀mí rúru.
One is lifestyle modification. Lifestyle.
O kò kí ní fẹ́ bí a ṣe ń gbègbè sí ayé wa.
How do you live your life?
Báwo ṣe gbègbè sí ayé rẹ?
Number one is that everybody that is an adult must learn to exercise.
Ìdí ni pé bàbá ti jẹ́ àgbàlagbà, a gbọ́dọ̀ kọ́ bí ń ṣe ìdárayá.
Exercise helps you to control your blood pressure.
Ìdárayá máa ń kọ̀ àwọn máa wà láti ṣe kí láti darí ẹ̀jẹ̀ wa ara wa.
And exercise does not necessarily mean that you have to go and register in a gym.
Pé àwọn ṣe ìdárayá kò tí òun ká lọ kọ́kọ́ sílẹ̀ ní ilé ìdárayá kankan.
Look at a simple exercise.
Ẹ wà àwọn kékeré.
Just jumping up in the morning,
Kí wọ́n fọ̀ dáwọ̀ báyìí.
right?
Kí wọ́n ṣe báyìí.
As many times as you
Kí
can.
wọ́n fòwò ṣe wọ̀ nígbà tó wọ̀.
If you jump like that in the morning, you count like 20 to 50.
Kó o kà lábẹ́ ogún sálẹ́ta.
In the evening, you're able to count something like that.
Tó bá tún lè kà ní ọ̀rẹ́ náà kò sí bẹ́ẹ̀ wà
You
nìyẹn.
have done some kind of exercise.
Ó ti ṣe àwọn ìdárayá díẹ̀ kan nìyẹn.
Another exercise you can do is to run a walk.
Kó o rìn.
Okay? You walk in the area that cars are not passing to knock you down.
Wàá rìn níbi tí wọ́n pé ọkọ̀ òkè gbà tó lè gbáyàn wàá rìn bẹ́ẹ̀.
I know some of you will say, I go to work. I walk to the market.
Ọ̀pọ̀lọpọ̀ á ní ẹ mo máa ń rìn ọjà mo ń rìn lọ bí iṣẹ́.
That is not enough.
Ìyẹn ò tó.
We are talking of walking fast.
Aṣọ nípa rírìn kíákíá.
We call it brisk walking.
Ẹ̀yìn kíákíá.
You know, walking fast.
Ìrìn ìdára kíákíá.
You can do it in your compound.
O lè ṣe ní inú ibi tó ń gbé.
You can do it on your street.
O lè ṣe ní àdúgbò rẹ.
Sorry for that disruption.
Ẹ jọ̀ọ́ ẹ tẹ́tí sí wọn sọ yìí.
I don't know who has Toyota Highlander JJ.
and they work differently.
Wọ́n sì ń ṣiṣẹ́ ọ̀tọ̀ọ̀tọ̀ fún ara wọn.
If you take the medicine,
Tó bá ti ń lo àwọn oògùn yìí,
it should bring your blood pressure down.
á mú ìfúnfẹ́ àbúwá sílẹ̀.
But if it doesn't bring it down,
Tí ọ̀bá ti fà wá sálẹ̀,
you go back to the doctor.
ẹ pàdé bá dókítà.
He said that he will increase the dose,
Ó ṣe kó fi kún bó ṣe ń lò ó.
or we add another type to it.
Àbí kó fi kún oògùn tẹ̀ lò.
The scary part of what we are talking about
Ohun tó bani jù léwu jù lóhun tí a sọ yìí.
is that hypertension
Òun ni pé ìgbẹ̀yìn ló ń fún
does not have a cure.
kò ní ohun tó lè fi wò ó sàn.
What I mean by cure is that
Ìwòsàn ẹni tí mo sọ.
you have taken this drug
Kò tí náà wò.
and you say my BP will never go up
Wọ́n á
again.
ní ìfúnpẹ́ mi ò ní ga sí mọ́.
Irọ́ ni ẹ o.
You are lying.
If you take it,
Tó bá lò ó,
it will bring it down.
á fà wọ́n sálẹ̀.
It will go back up,
Ó lè pa àsókè.
and you take it again.
Wàá tún lò ó lẹ́kọ̀ọ́
If you
sí.
keep taking it,
Tó bá lọ àwọn oògùn
it will
yẹn,
keep bringing it
á
down.
máa fà wọ́n sálẹ̀.
But you don't say you have seen the doctor and doctor has treated me for
Wọ́n á ní
hypertension.
mo ti lóòótọ́ ti ṣe ìwòsàn mi.
I don't have hypertension
Mi ò ní
again.
ìfọ̀jà mọ́ ara mi mọ́.
It is only the doctor that will tell you that your BP is controlled now. Let's start reducing the dose.
Dókítà ló máa ní pé ìfúnpá ẹ̀ tí wọ́n lè ní sí jẹ́ ká dẹ́kun oògùn lílò rẹ̀.
Yes, so I know the question I usually get from people when I talk to them patients is
Àwọn
that
òbéèrè tí máa ń rí gbà láwọn ọ̀rẹ́ tí wọ́n sọ̀rọ̀ ní pé
doctor, I don't want to start this drug for BP
àwọn ní dókítà mi ìfẹ́ lò ògùn fún ìfúnpá yìí.
because I heard that if you start BP medicine,
Tó náà bá ti ń lo ògùn fún gíga,
take it for a lifetime.
ìyá máa lè tọ́jú ayé ẹ̀ ní
Well, the answer is this.
ìdáhùn eléyìí.
Remember we mentioned complications of high blood pressure.
Ṣé mo kẹsẹ̀ nípa àwọn tí ó máa ń bí ìdòwúru?
So if you don't take it,
Tẹ́ ẹ̀ bá ti lò ó,
what will now happen?
kí ló máa ṣẹlẹ̀?
Do you want to live your life to the risk of kidney problem?
Mo fẹ́ pípẹ́ sí ayé ẹ̀ tó kí kìdìrín rẹ̀ kó má ṣiṣẹ́ mọ́.
So if I say take this medicine and you will likely not have kidney problem,
Tí bá ní lo ògùn yìí kó má ní kìdìrín tí wọ́n ti dìjà kúrẹ̀.
and don't take this medicine and you have kidney problem,
Tàbí bá lo ògùn yìí kí kìdìrín rẹ̀ kó má ṣiṣẹ́ mọ́.
which one will you do?
Èrò ló máa yàn níbẹ̀.
I'm sure everyone will take the choice of taking the medicine
Àìsàn burúkú fún ọmọ máa yàn láti máa lo ògùn.
because the problem of the complications
Torí wàhálà tó wà lẹ́yìn rẹ̀,
is not that what you are thinking.
ó jọ ohun tá a lè fẹ́ sọ wá.
If you have had kidney problem before,
Bàbá ti fẹ́ pé kìdìrín rẹ̀ kò ṣiṣẹ́ mọ́.
if kidney fails,
Tí kìdìrín bá dáwọ́ ṣẹ́ dúró,
so while you are living your life,
ó ṣe máa ń pèsè ayé rẹ̀.
don't be writing your will
Máa kọ àkọsílẹ̀ rẹ̀ sílẹ̀.
because it will drain everything you have in this world.
Torí yóò fà á mu yóò sì fà á jẹ ọkọ tó láyé yìí.
You go and be doing dialysis.
Láti máa ṣe àyẹ̀wò lórí
It's
ọ̀sẹ̀
not,
lọ́sì.
it's not what you want to wish people for your enemy.
Kò ní ṣe ohun tó fẹ́ fún ọ̀tá rẹ̀.
I will mention it that hypertension causes heart failure.
Wọ́n sábà èdè ìwúrọ̀ máa jẹ́ kí ọkùnrin kó dáwọ́ dúró.
If an ailment causes heart failure for you,
Tí ẹ̀sùn kan bá jẹ́ kí ọkùnrin kó dáwọ́ dúró,
have you not worsened the case?
ṣé o ti dá gbogbo nǹkan báyìí?
How much is hypertension medicine?
Kí ni oògùn ìfọ̀ gíga?
It is cheap when you buy it from the nearest pharmacy.
Kò wọ́n lọ́pọ̀lọpọ̀ ìjàmbá náà tó ń ta oògùn.
What you do is when you go to the hospital,
Wọ́n lọ sílé
it
ìwòsàn.
also gives you a prescription that you use.
Wọ́n fẹ́ náà oògùn tó máa lò.
Then you can appeal to the doctor.
Ló lè wá dókítà sọ̀rọ̀.
Can you please write it on a prescription for me to buy in my area?
Ló ṣe lè kọ́ sílẹ̀ fún mi kí n rà níbi tí wọ́n gbé.
Doctors are men of God.
Àwọn dókítà lè rìn ọ́
I will
lọ́wọ́.
write them for you to go and buy,
Wọ́n kọ̀ fún láti lọ rà.
which will be cheaper for
Èyí
you.
tí ò ní jẹ́ owó tó wọ́n fún yín.
I hope with these few lines of mine,
Láwọn ọ̀tún tí wọ́n ń sọ yìí.
you have a knowledge of high blood pressure.
Àti ní òye ìfọ̀ gíga.
How often should I check my blood pressure?
Nígbà wo ni kí n máa ṣe àyẹ̀wò ìfọ̀ mi?
Two categories of people again.
Àìpé àwọn méjì ló wà ní àyẹ̀nà pẹ̀lú.
Those that are hypertensive
Àwọn tí fún wọn ta gidigidi gan.
and those that don't have.
Àtàwọn tí ò ní rárá.
If you don't have a high blood pressure,
Tí fáyọ̀ bá ga.
you can check your blood pressure
Wọ́n lè mọ òfúfà rẹ̀.
maybe every 4 months.
bí ẹ̀kọ́ láì oṣù mẹ́rin.
Yes, if you don't have high blood pressure, at least you have done the first one, doctor says you don't have.
Wọ́n ní òní.
They check you again, they say you
Wọ́n
don't
sì
have.
bẹ̀rù wọ́n ní òní.
But if you have high blood pressure,
Ṣùgbọ́n tí fúnra ẹ̀ bá ga gidigidi gan.
it doesn't need to be very, very high.
Òní náà kò ga gan.
Once it's high
Tó bá ti ga.
and they have given you medicine,
Wọ́n lè fún ẹ ní òògùn.
you should check your blood pressure every week
O gbọ́dọ̀ máa ṣe àyẹ̀wò fún ara ẹ̀
so that
lọ́sẹ̀ ọ̀sẹ̀.
you know if this BP you are having is coming down or is going up.
Kó bá lè mọ̀ pé àìfún àìṣó wálẹ̀ ní àbúrò lọ sókè sí.
Because,
Nítorí pé
like we said,
bá ṣe ti wí
there is no cure.
kò sí ohun tó lè yọ kúrò pátápátá.
There might be a time you come, the doctor checks your blood pressure. Let's take an instance.
Fún àpẹẹrẹ,
You come to the hospital,
wọ́n sílé ìwòsàn.
your blood pressure is say 150/100.
Àwọn ìfúnpá rẹ̀ ó wà ní 150 sí 100.
Now we place you on medicine
Àgbẹ̀ ẹ̀sọ́ ní òògùn.
and you have been advised to reduce salt.
A sì bẹ̀rẹ̀ lọ́nà tó má jẹ pọ̀
And
mọ́.
your cholesterol is not
Pé
high.
ẹ̀jẹ̀ tó ní gbogbo ga.
No,
Ọ̀la ìlú ìjẹ́ ìwò ga.
yes, alright, that's fat in your
Ọ̀la tó
blood.
wọ́n fẹ́ jẹ ìwò ga.
Please, before I continue,
Tó tẹ̀síwájú.
when we say cholesterol aura in your blood,
Wọ́n ti nípa ọ̀la tó bẹ nínú
you must not be fat.
Kò ní kó bá sanra bí
Some people say, see, me that I'm like this,
Èyí tí mo ti rí báyìí.
I can never have high cholesterol.
Ọ̀la ò lè bọ̀ náà jẹ̀ mí.
It doesn't follow like
Kò
that.
túmọ̀ síbẹ̀ rárá.
You can be slim
Ó lè tí
and have a bad cholesterol.
kí ọ̀la pọ̀ ní ẹ̀jẹ̀
You
rẹ̀.
can be very fat
Kò sì lè sanra.
and still have a normal
Kí
cholesterol.
ẹ̀jẹ̀ tó ọ̀la bá pọ̀ ní
So
ẹ̀jẹ̀
the only way we know if your cholesterol is high or
rẹ̀.
normal
Wá ṣe lè mọ̀ pé wàá pọ̀ ní ẹ̀jẹ̀ rẹ̀.
is when you do the test.
Tó bá ṣe àyẹ̀wò rẹ̀.
Like I said, the test is called cholesterol test.
Èmi pé kí á ṣàyẹ̀wò.
You can do it in any lab,
Ó lè ṣe ní
but you must take the result to the doctor in any hospital.
Wọ́n wà á mú àyẹ̀wò ìyáwó sáyẹ̀wò ní lọ sí dókítà lọ́sítù.
Please and please again, I will round up by saying that
Ẹjọ́ máa parí báyìí pé
hypertension, that is high blood pressure,
ẹ̀fọ́ gíga
does not have a cure,
kò ní ìwòsàn pátápátá.
but it has a treatment.
Ṣùgbọ́n nípa ṣe ìtọ́jú rẹ̀.
And if you treat your blood pressure regularly and you are fine,
Kàkà tọ́jú fún nígbà dé ìgbà.
Pastor mentioned how long people were living in those days.
Olùsọ̀rọ̀ sọ bí àwọn àṣẹ ń gbé nígbà àná.
And Methuselah, we were told, is one of the men that the oldest man that ever lived.
Àdúgbò ìṣẹ́ ẹ̀ ní ọkùnrin tó dàgbà jù lórílẹ̀-èdè ayé.
You might live as old as Methuselah
Ó ṣeé ṣe kó o pẹ́ níbi
and you
ìṣẹ́
will not have complications
Ó
of
máa ń jẹ́
hypertension.
àwọn wàhálà àti ìdààmú.
I want to thank Pastor Medoye
Mo fẹ́ bàbá olúwa.
and Pastor Mrs. Medoye for
Màmá wa olúwa.
giving me this platform
Mo ní
to
àǹfààní
teach
ìṣẹ́
my people again.
láti kọ́ yín lẹ́kọ̀ọ́ sí.
At any time you will call me again, I promise I will always know.
Màá ní màá gbé ìgbà àti wá.
Thank you.